Have you ever found yourself sick or hurt and thought, should I go to the ER, the urgent care, or just call my doctor? You're not alone. Every day, millions of people face the same question, and many end up in the wrong place. Sometimes it's just confusing, other times it's because no one really explained how the system worked. The truth is, healthcare can feel complicated, not because you did anything wrong, but because the US healthcare system evolved over time, not all at once. It's like a patchwork quilt that keeps getting new pieces added on. But today, we're going to simplify it. By the end of this module, you'll know where to go, what to expect, and how to avoid unnecessary costs. All right, for this module's agenda, we have why the healthcare system feels confusing, hospitals, the expensive safety net, clinics, your first line of defense, urgent care, the middle ground, new players, telehealth and retail clinics, myth and mistakes, how insurance fits into the picture, putting it all together, closing in next module. When was the last time you needed care? Did you start at primary care or jump straight to urgent care or ER? Why the healthcare system feels confusing. The US healthcare system didn't start out as one plan, it grew in layers. In the early 1900s, hospitals were charity based or community run, mostly for serious illnesses. By the 1950s, employer based insurance became the norm, linking coverage to jobs. The 1970s brought urgent care centers. The 2000s introduced retail clinics. And the 2020s made telehealth mainstream. That's multiple different entry points, each with different hours, pricing, and rules. Here's a simple way to picture it. Think of healthcare as a triangle. The base is primary care, your foundation for long term health. The middle layer is urgent or specialty care for specific issues. The top is hospitals for emergencies and complex treatments. The higher you go, the more intensive and costly the care. Think about the last time you needed care. Did you start at the base or jump to the top? That choice can change your whole experience and bill. What would make you choose the ER without hesitation? And what could safely wait for clinic or urgent care? Do you know the difference between facility fee and professional fee on your hospital bill? Hospitals, the expensive safety net. Hospitals sit at the top of that triangle, the safety net for serious, unpredictable, or life threatening problems. Chest pain, shortness of breath, severe bleeding, stroke symptoms, surgeries required, anesthesia, complicated illnesses needing specialized equipment or monitoring. Hospitals operate 24/7 with ER physicians, nurses, and specialists ready for anything. And that round the clock readiness makes them expensive. Recent estimates place a typical ER visit around $1,700 or $2,700 on average, depending on what's done. If you're admitted, costs vary widely, often several $1,000s per inpatient day and tens of thousands for multiple days stayed. Sites like fairhealthconsumer.org show local ranges. Now, there's two parts to most bills: a facility fee for the hospital's equipment and space, and professional fee for the doctor or team that treated you. Now, here's an example. Alex goes to the ER for a migraine. He gets a CT scan and IV medication. It wasn't life threatening, and the bill was $1,800. At urgent care, the same relief might have cost $200. Hospital saves lives when you need them, but the key is using them for true emergencies. If you felt a sudden chest pain, the ER might be the right move, but a mild fever or earache might be a clinic or urgent care visit. Matching the setting to the problems keep you in control of your health and your wallet. Do you have a primary care home base? And when did you last use it for prevention, not just when you're sick? Which routine visit, checkup, vaccine, labs could you schedule this month? Clinics, your last line of defense. Clinics are where most care should start. They include family doctors, internal medicine providers, nurse practitioners, and community health centers, your long term care partners. Clinics focus on prevention, education, and continuity, not just treating illness, but keeping you well. Give your clinician the heads up front. You might go to the doctor for checkups and screenings, vaccines, blood pressure or diabetes management, prescription refills, referrals to specialists. Now, a typical primary care visit runs about $100 to $150 without insurance, and often just a small copay, $20 to $40 with insurance. Many offer same day telehealth for minor issues, a 10-minute video visit for codes or refills. Now, here's an example. Mariah wakes up with a sore throat, books a telehealth visit, and gets a test ordered within hours. No waiting room, no extra fees. Clinics are your home base. Stay connected and you catch problems early and avoid costly ER trips later. If your clinic were closed tonight, where would you go for a sprain or ear infection and why? Urgent care, the middle ground. Urgent care centers bridge the gap between your doctor's office and the ER. They're open for evenings and weekends for issues that can't wait days but aren't life threatening, such as minor cuts or burns, strains or simple fractures, ear or urinary or sinus infections, vomit or dehydration, allergic reactions without breathing problems. Typical cost is about $150 to $450, still far below ER charges. Now, these costs depend on your area, your state, and where you live. If urgent care finds something serious, like heart trouble, for example, they'll stabilize you and transfer you to a hospital, creating two separate bills. Now, here's an example. Jordan sprains her ankle at a weekend game. Urgent care does an x ray, wraps it, and she's out in an hour for $180. The ER visit would have topped $1,000. Urgent care is your safety valve when your clinic is closed, but it's not an emergency. Could your next simple need, such as rash, refills, sore throat, be handled by telehealth or a retail clinic instead of a full office visit? Which option will save you the most time this week? The new players, telehealth and retail clinics. Healthcare is evolving, and two new options makes it more convenient than ever. Telehealth, video or phone visits for minor issues like rashes, sinus infections, or refills. Many plans cover these visits at low or no cost. Surveys show about 8 in 10 patients say that their main issue was resolved through telehealth. Retail clinics and pharmacies like CVS or Walgreens handle predictable care, flu shots, strep throat, sports physicals, and post their prices upfront for transparency. Could telehealth and retail clinics save you time off work or school? These options were built for that reason. Quick, affordable care that fits your schedule. Which of these do you still believe a little? ER is the fastest, urgent care can do everything, or telehealth isn't real. What would change your mind? Myth and mistakes. Let's bust down a few common myths. Myth number one: the ER will see me faster. The reality: ER use a triage. Sick is first, not first come, first serve. Myth two: urgent care can handle everything. The reality: severe chest pain or injuries still need the ER. Myth three: clinics are just for checkups. The reality: they also treat infections and manage chronic conditions. Myth number four: telehealth isn't real. The reality: it's proven safe and effective for many routine needs. Do you know your plan's typical copay or cost share for clinic, urgent care, and ER in that order? Before your next visit, will you check the network and call the nurse line on the back of your card? How insurance fits into the picture. Your insurance plan is like a map showing which doors are easiest to open and how much each visit costs. Generally, cost sharing follows this pattern: primary care, lowest copay or cost share; urgent care, mild range; ER, highest. Exact amounts vary by plan, but the order is the same. If you go to a in-network clinic, your insurer has negotiated lower rates. Out-of-network care can mean much higher bills, sometimes the full price. To avoid surprises, check your insurer's website or app for visits, and if you're unsure, call the number on your card. Now, flip your card over. Most plans list a 24/7 nurse line. You can describe your symptoms and get guidance for free on where to go. Now, here's a pro tip: if you ever received a large bill, request an itemized statement. Billing errors are common, and you have the right to question charges before paying. For your next health issue, which layer will you start at? Clinic, urgent care, retail, or ER? What quick self check will you use to decide in the moment? Putting it all together, let's zoom out. Healthcare is layered: base, clinics and primary care; prevention and long term wellness; middle, urgent care and retail clinics; immediate but minor problems; top, hospitals and ER, true emergencies and complex care. And woven through all layers is your insurance and telehealth access, tools that make care easier and more affordable. Who will you see first for your next concern? Primary care, urgent care, telehealth, or ER, and why? What's one step you'll take this week? Add a nurse line to contacts, find a primary care clinic, or book a telehealth option. You've just built your mental map of the US healthcare system, and that's powerful. You understand how each setting works, what's it for, and how to use it wisely. That knowledge alone can save you time, money, and stress. In the next module, Who's Who in Healthcare, we'll focus on the people inside these settings: your primary care doctor, specialists, and hospitalists, so you know exactly who to see and when. I will see you in the next module. Thanks for watching.